with these consolidations comes a corporatization of medicine that's less than ideal for patients and providers.
Welcome to Off the Chart with Medical Economics, a podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. I'm your host, Keith Reynolds, and today we feature an interview between Medical Economics Managing Editor Todd Shryock and Dr. Joseph Betancourt, President of the Commonwealth Fund. They're talking about healthcare consolidation and what impact it's having on the industry, doctors, and patients.
So I guess to kind of set the table, can you give me an idea of how consolidation is trending with medical practices? Is the pace increasing? Is it slowing? What's going on with the pace of consolidation?
Yeah, there's no doubt that, over the last 7 to 10 years, we've seen a very large increase in consolidation generally. I'd say the consolidation that's gotten the most attention is a consolidation at the health system level. And we've had probably, I think about 1,000 of 5,000 hospitals are now in systems that they've gone into consolidated systems. I'd say that the notion behind consolidation, the driving theory behind it, from people who are executing consolidation, is that by consolidating, you can create efficiencies, you can make care more effective. It's often said that you can eliminate redundancies, that you can improve health information systems. This notion that by consolidating and bringing disparate parts together, and what many claim is a healthcare system that's very fragmented, will be helpful for patients and will be helpful for providers. Many say, well, providers would really benefit from having many of the administrative issues that they have to deal with on a onesie-twosie basis kind of taken off their plate, and a consolidated system allows for that. It allows for more seamless patient interactions, better communication among providers, all those things. So I guess I'd say definitely a trend towards consolidation. Definitely, we're seeing it pretty extensively in the healthcare system level. And I would say that the party in charge of monitoring these consolidations, the Federal Trade Commission, really is tasked with the idea of, are these consolidations anti-competitive in any places, or are they creating monopolies in regions, right? And I think the data has shown that there's only been 13 consolidations that were rejected by the Federal Trade Commission in the last few years, among which independent analysis shows that probably up to 200 could have been, right? And so I think you have leaders who are pushing for consolidation, really putting together all the pros that I've suggested. You have the Federal Trade Commission underpowered in its ability, I think, to really look at this carefully and perhaps buying into some of these notions. But Todd, the key challenge here is that to date, the data on living up to that potential consolidation is falling short. What we are seeing, no doubt, as we see more consolidations, is no real improvements in quality, if anything, level or decreasing in quality. I would say that we're seeing, no doubt, increases in prices. I would argue, and this is based on my experience, I think it is becoming increasingly confusing and frustrating for patients to figure out where to go and how to navigate oftentimes these consolidated systems, which is almost antithetical to why people are saying consolidation should be put forward in the first place. It's actually become challenging for patients. And then finally, for providers, I think there's been a real loss of agency, if you will, sense of being able to have a voice or feel like you have control in where these big systems and consolidated systems are going. And so this is what we see. more consolidation on the promise of these improvements. The data showing those improvements aren't really being realized. And I would argue patients and providers being stressed in a variety of different ways about where this consolidation is going. And so I'll stop there. I could go more into primary care, but I just want to frame that up in a big picture.
So with all this consolidation, for the practices that have not sold yet, can they survive with all these major players around them?
It's a really good question. And I think, even in primary care, I would say even those primary care practices that are within these large systems are not realizing the potential, the benefits of the potential that is being put in front of them. I think largely, even among these large systems and these large consolidated systems, we're seeing that primary care is being undervalued. Primary care is being used as a conduit to largely higher margin services. And we've seen, as a nation, we spend about 4 to 5% on primary care compared to other nations that spend, up to 14 to 15%. So I would argue that primary care practices within consolidated systems are challenged, and outside exceptionally challenged, because now they are forced to compete with very, very large players. And at the end of the day, they might not be able to compete. So I'd say in both circumstances, the primary care practices are challenged. And certainly if you're not part of a system, you're even more challenged. And that's why we've seen more and more of these practices be willing to sell, be willing to join into these systems, because they, I think largely now we see 3 out of 4 physicians are part of either a private equity practice or a consolidated system or corporate practice, right? 3 out of 4. It's only 1 out of 4 physicians still remain independent. I think there might be a place for some more independence in places like rural areas and the like, where there's no other show in town. But in many, many areas, I think these practices that are not part of systems are at risk. And I think that's a challenge. Their power to be able to negotiate becomes extremely limited. And I think the other aspect of consolidation that we're seeing is that from a business standpoint, those large consolidated systems get more power when they negotiate with payers. That's why costs go up. These smaller practices don't really have a prayer in that environment.
With these larger entities not seeing the results that they thought they were going to see, and there's been high profile, Amazon, Walmart, CVS all came in with much fanfare and have quickly said, we can't make money here, we're out, for the most part. Is the shine wearing off? Is that going to maybe slow things down a bit? Or is it just the next person in line thinks, hey, I can do this? And
It's a fascinating question. Yeah, I think it's fascinating because many, many people over our history have said, I could solve this. And I think to your point, these, disruptors, non-traditional healthcare players have entered healthcare with the notion that if we bring business principles to the care of medicine, that basically the healthcare system is poorly organized, inefficient, and we can solve that. And I think our incredibly fragmented healthcare system and payer space has made them quickly realize it's not that easy, And I think Walmart's exit to me is signal, not noise. It's signal that it's not as easy to make margin here. It's not as easy to find those efficiencies, and it certainly may not be generating the revenue that they anticipated, and some of the other benefits. It's going to be interesting to see what happens with Amazon. It'd be interesting to see what happens with Aetna and CVS. It's interesting now that CVS is looking for a private equity partner to help support Oak Street. Right? That's another signal to me. That's not noise. And so to your point, I agree. I think this isn't a problem that's just easily solved with business principles and some of these disruptors. I think the story will unfold, but we're starting to see signal here that just isn't something that by bringing business principles you're going to be coming in and beating up the inefficiencies that traditional healthcare systems have had. I'll end by saying that I think one thing that they've really helped shape the industry to do is focus more on access and convenience. There's no doubt that the large brick and mortar systems looked at what a Minute Clinic could do, and how consumers flocked to that convenience. And now many of them are building their urgent care centers and the like to meet that need of convenience. And so they did help, I think, shape the industry to be more efficient, to be more effective, to survive, to be more convenient. But I think they haven't been able to create the value that they wanted so far. And so, that story's still in play.
Okay. Yeah, I wanted to ask about if you've seen any impact on access to services, but it sounds like if anything, maybe that's the one area where consolidations actually maybe helped a little bit, or no?
Well, it's a good point. I think it's an area where, because of those disruptors, the large systems have needed to be more attentive to it. Now, whether they've achieved it, I think they've gotten better. But if you still look at access and affordability today, particularly in primary care, and this is in large part due to the primary care workforce shortage, the fact that less people are going into primary care, that primary care is underpaid, and we're looking for that payment reform to really fix some of that. This is a major issue on the Hill. Despite the best efforts of large systems to make themselves more accessible and affordable, I think they're still nowhere near where they want to be. So there's still big challenges there, but they're a lot more attentive to it because of the Amazons and the CVSs of the world and the Walmarts, because I think they saw some key ingredients there, and they realize if we don't change, we may not be around. They actually might win. So yeah.
Okay. What about continuity of care? Has there been any impact on that important, especially in primary care, that doctor-patient relationship? Can you still have that old-fashioned relationship, or is that suffering because of consolidation as well?
Yeah, Todd, it's a great question. I mean, I think putting consolidation aside for a second, I'd say that, what we do see because of those disruptors and some generational changes is that there are, individuals who don't have chronic conditions and who have low acuity issues that emerge, a cold, sore throat, urinary tract infection, particularly generationally, I think voted with their feet and will sacrifice a relationship for access and convenience. Individuals with chronic disease, that relationship really, really matters. And so I think what we're seeing, Todd, is an evolution such that we might see sub-segmentation based on the patient's needs that will prioritize or deprioritize the importance of that relationship and the traditional primary care doctor, right? I take care of a lot of, 18, 19-year-olds. I see them once a year. If they have a cold and I'm not available, it makes sense for them to go see somebody else, and they'd probably prefer it if they can't see me for 2 weeks. I think that's probably gonna end up being more formalized down the road. Does consolidation impact this? I'd say, maybe not so much. I don't think that there's a clear impact between consolidation and the primary care relationship, as long as those large systems invest in primary care. So if you're a large consolidated system and invest in primary care, then yeah, that those relationships are gonna go. That stickiness and the importance of the primary care relationship is going to go away. But if you're a big system and you really prioritize primary care, I believe you could maintain that continuity. It's a matter less of consolidation and more about prioritization. And I'd say to date, the consolidated, large systems, for a lot of different reasons, haven't particularly prioritized primary care.
For physicians who end up in these larger systems, do they sacrifice any of their autonomy? Do they have the same decision-making power that they had before? How does that work?
Yeah, Todd, I think, many enter into these systems under the guise that a consolidated system will take away a lot of the administrative burden that you have, billing, IT, and the like. But then the trade-off ends up being that sense of agency and autonomy and your voice being heard in big decisions around where the system goes, right? And so I think the impact has been demoralization, and I think the impact has been loss of agency. And what is this translating to? This is translating to the burgeoning unionization movement that we're seeing. First, we've seen it most strongly among trainees and residents. But you're starting to hear and you're starting to sniff out and you're starting to see Alina in Minnesota. We here at Mass General Brigham Salem Hospital, group of 60, 70 some odd doctors unionizing. You're starting to see more of that. So the way that this is playing out, and we might see an increase in it, is doctors starting to say we need to unify our voices to regain our agency and power to do right by our patients. Because I think there is a sense of, with these consolidations comes a corporatization of medicine that's less than ideal for patients and providers.
Outside of medicine, usually working for a large corporation as opposed to like an independent family business, the pay and benefits are better. Is that true for physicians as well? Are they at least getting better pay and benefits when they go the corporate route as opposed to remaining independent?
It's a good question. I think it's very variable dependent on specialty. Some specialties do better on their own. Some do better as parts of systems. It depends on location and market. I don't think there's a particular trend to say that, I don't know of any data. I haven't seen any studies that would say, physicians in consolidated systems get paid more or less. I think it's variable. I think it depends on the who, the what, the where, the system. Yeah, there's a lot of variables there. I don't think that question's been answered yet.
You've mentioned a few times the trying to escape the administrative burden as one of the reasons why you would join a larger entity. Has that proven true that at the very least, the doctors have less administrative tasks to deal with?
Look, I think we definitely, having just individual practices does have implications for quality of care, right? I think people working together can improve quality, there's no doubt. So I just set that aside here. But, to your question, I think individuals who enter into these systems probably do find some economies of scale. Perhaps they are relieved of some administrative responsibilities related to quality or billing and the like. Those are taken up as responsibilities of the system, which is, I think, a benefit. Two things I'd say: at what expense, right? And the second is there's still a lot of administrative burden that comes with just care in general. So while you enter a consolidated system and it might decrease some of the administrative burden, the practice of medicine is leading to just generally more administrative burden with the electronic health record. So a long way of saying, Todd, if I'm in a consolidated system or I'm independent and I'm on Epic and I have in-basket, my in-basket's still going to have 90 messages. I think the systems are trying to address that now. So for example, my practice, they're going to have nurse practitioners reviewing my in-basket. So it may be that consolidated systems could throw more resources at decreasing administrative burden around the day-to-day. And I think they're trying to, so we'll see how that plays out. But again, I think it might relieve some. There's some that it hasn't relieved yet, and it's trying to pay more attention to how it can relieve them. And we'll see how that plays out with time.
So if I'm an independent physician and I care about quality care for my patients, what would you tell me in today's world? What do I do?
Yeah, I think over the years, we've seen small practices be able to, come together as part of collaboratives, data share, be part of, quality collaboratives through a variety of different national players. So, quality really matters. And I think when you're running a practice, oftentimes your data abilities to monitor quality, the amount of time that you could spend and kind of developing registries to make sure all your patients are at, target around their cholesterol. There are a lot of systems related issues that, not because of lack of caring, but because of lack of resources and time, you might not be able to invest in. That's been some of the challenge of smaller independent practices. As practices have grown, they've been able to add those capacities in. But I think independent practices, certainly there are things they can do together and with payers and with other partners that could help them focus on these things, which are of critical importance.
Any other thoughts on consolidation that we haven't talked about?
No, I think I'd end by saying that, we definitely have a trend towards consolidation. I think the jury's definitely still out on the, are these consolidations yielding the benefits they propose? While at the same time, we're seeing some of the challenges to providers and patients. So this is an unfolding story, but we're in the midst of a trend and we'll see, kind of where it goes.
Again, that was Medical Economics Managing Editor Todd Shryock talking to Dr. Joseph Betancourt, President of the Commonwealth Fund. My name is Keith Reynolds, and on behalf of the whole Medical Economics team, I'd like to thank you for listening and ask that you please subscribe to the show on Apple Podcasts and Spotify. Also, if you'd like a digest of the best stories Medical Economics publishes delivered straight to your email 6 days a week, subscribe to our newsletter at medicaleconomics.com. Thank you.